Hello, welcome back to my channel. I'm Chucho and I'm a health personnel. Thank you so much for coming back. If you're an old subscriber, thank you. If you're a new subscriber, I wish I could give you that hug right there. Before you visit your doctor, you need to know this. Do you have loose stools? What did you eat before the loose stools? So loose stools or watery stool 3 times or more is termed diarrhea. And this diarrhea is gotten through contaminated food or water, food allergies, medication use or anxiety. Yes, when you're about to go for that test. Yes, that anxiousness. Yes. Loose stools within 24 hours is termed infectious and could be caused by notaviruses, bacteria like E. coli and protozoans. These viruses and bacteria attack the lining of your intestines, yes, and they cause it to become inflamed. And whilst the system wants to flush out this infection, there's this mucus and fluid that is being secreted, and that is what you experience as watery stool. So most watery stools settle within 4 to 7 days. Like you wish you could run. There's always abdominal pain and cramping, yes, and you can have your stool being stained with blood or mucus or fat. Yes, also there's vomiting and there's general body weakness as well. So we'd say diarrhea is good in a way because it ends up clearing your system of all infections and toxins that the body does not need. Yes, but please, when it's beyond 24 hours, make sure to seek medical advice. Loose stools do not only contain water, but important minerals such as salt and potassium. So whilst at it, you make sure to take in more fluids containing water, salt and sugar to replace electrolytes that are lost. Before you visit the doctor, before you rush out of home to the hospital, make sure to take in this simple solution: 500 ml of water, half teaspoon of salt, and 2 to 4 tablespoons of sugar. Add any juice of your choice that you are conversant with, that you won't alarm your diarrhea more. Make sure your veggies are well boiled before you take them in. Eat lots of pasta, lots of rice, soups that you can tolerate. Like, make sure your food, whatever you take in, you are able to tolerate before you take them in. Yes, and avoid fatty meals because they are difficult to digest at that particular time. Avoid dairy products because you might have a temporary intolerance, like lactose intolerance, which is the sugar found in milk, yes, in dairy products. Anti-diarrheas are okay. They are okay to take. They are over-the-counter medications, lots of them that you can take in, but they just help reduce or control the frequency of stool and the agency to go visit the toilet. But the downside about this anti-diarrhea is they end up pulling water from the gut and causing dehydration. They also do not really eliminate the infection. During diarrhea, we term most gut bacteria are displaced. There's a sort of imbalance in the system. So probiotic has good bacteria that help keep the bacteria at that particular level, that the gut needs to function properly. Over-the-counter medications are not really important as much because they can tend to give unwanted side effects like blood in stools, dehydration, nausea and vomiting, and also can kill healthy bacteria. This is when you have to rush to the hospital, yes, when you see these signs. So severe pain and fever and other medical conditions that is causing you to have diarrhea, and also pregnant women are much important. It's much important for a pregnant woman to visit the hospital on time if they are having several loose stools. These are some signs and symptoms of dehydration that you need to pay attention to. There's sunken eyes, there's nausea and vomiting, there's lightheadedness, so dry tongue, loss of appetite, muscle cramps, rapid heartbeats, and tiredness. Thank you so much for watching. Make sure to comment down there if you got to the end, And if it was really helpful, guys, let me know. Yes, this is very important. Almost about 90% of cases come in with complaints of diarrhea or vomiting, and you need to seek medical advice or medical assistance on time. Thank you so much for watching. I'll be right back. Subscribe, like, and comment. Bye.